Come in.
Hello,
Hi.
my name is Natasha. I'm one of the nurse practitioner students, and today I'm going to be doing a physical head to toe exam.
All right.
Can you tell me your full name and date of birth, please?
Yeah, Adam Williams, July 1st, 1983.
Perfect. Okay. So it looks like the MA got your vitals up front. Your heart rate is 73, blood pressure is 121/80. Your oxygen saturation is 98%, and your temperature is 98.5, which are all within defined limits. And it looks like your height and weight has stayed the same, which is good, and it is appropriate for your age.
Cool.
She also conducted a Snellen chart, which is a visual acuity exam testing cranial nerve 2, and it looks like you have 20/20 vision in both eyes, which is also great.
Cool.
All right, let's go ahead and get started. I'm going to do some hand hygiene here. Are you comfortable how you are? Do you need to use the restroom before we get started?
Yeah, I think I'm good.
Okay, you're good with the temperature in the room?
Mm-hmm.
Okay. Do you have any pain? Anything bothering you lately?
No, everything's been going pretty well.
Good.
Yeah.
All right. So I'm going to just start out with my visual inspection. I'm going to test cranial nerve 7, the facial nerve. So go ahead and just close your eyes for me. And I'm just going to touch your face. And you let me know if the sensation is equal on both sides of your face.
Yes. Yes. Yes.
Perfect. Okay. I'm going to just palpate your scalp here, feeling for any depressions or lumps, which I do not feel. Your hair appears to be healthy, shiny, and good. You have good distribution, no evidence of any infestations. And also part of my general survey, my patient appears alert, oriented, well-nourished. He's dressed appropriately for the climate, and he appears to be agreeable with the exam. Okay, testing cranial nerve 5. I'm going to have you puff out both cheeks and smile real big. Good. Erase both eyebrows. Excellent. Okay. I'm going to palpate your temporomandibular joint here. Go ahead and open and close. Good. I didn't hear or feel any clicking. All right, moving on to your eyes, starting with my visual inspection. I don't see any edema or crusting or lesions. I'm going to pull down on your eyelid here. Conjunctiva is nice and pink, the sclera is white, and there's no evidence of any jaundice. Okay, here's my pen light here, and assess your pupils. So just look straight at me. Good. So pupils are equal round and reactive to light, and there is a consensual response and accommodation. Next, I'm going to test your extraocular movements, cranial nerves 3, 4, and 6. So just follow my pen light with your eyes only.
Okay.
Very good. And there was no nystagmus noted. Okay. Moving on to your nose. Go ahead and tilt your head back for me. I'm going to look up in here. The septum is midline. The turbinates are pink and moist. Do you have any congestion currently? Okay.
No.
I'm going to have you hold down one side of your nose and just breathe in. Good. And other side. Excellent. Okay. I'm going to palpate your sinuses here. This is frontal and maxillary. You have tenderness in those areas?
Nope.
Okay, good. All right, go ahead and open your mouth, please. Say ah. Good. Stick your tongue out for me. Good. So uvula is midline. The oral and buccal mucosa is pink, and he has good dentition. And can you move your tongue side to side? Good. That's testing cranial nerve 11, the ossopharyngeal. All right. I'm going to palpate your lymph nodes. Starting here. This is pre-auricular, post-auricular, cervical, tonsillar, submandibular, and submental. I do not feel any hardened areas or nodules. Was any of that tender?
Nope.
Okay.
Good.
going to palpate your thyroid gland here. So trachea is midline. Here's cricoid. All right, I'm gonna displace your trachea slightly and have you turn your head to the right.
Okay.
And palpate here on the left. So go ahead and turn a little bit. Good. Tenderness here?
No.
Okay, and other side? All right, excellent. Okay, go ahead and shrug your shoulders up against my hands. Very good. That is assessing cranial nerve 12, the spinal accessory. Alrighty. Next, I'm going to move on to your ears. Do you have any tenderness on that outer ear here?
No.
As I touch, I'm going to palpate your tragus here. Tenderness here?
No.
Good. All right. Going to test your acoustic nerve. Let me know if you, when you stop hearing this sound.
No.
Okay.
No.
Excellent. I'm going to take a quick peek. But before I do so, I want to do a fundoscopic exam here. In the clinic, I would dim the lights. In peds, I would test for the red reflex. And I can also do that in my adult patients to assess for any signs of cataract or clouding in the cornea. I'll also do the corneal light reflex, which is the blink reflex. Another pediatric exam I would do is the cover-uncover test, where I would have them shield one eye, focus on an object, and then uncover the eye and see if that eye deviates, which is a test for strabismus. All right, so go ahead and just look forward for me, Adam, and I'm going to shine this light in your face. I'm going to touch your shoulder and get kind of close to your face, and I apologize because this light is very bright. Okay, I see red reflex. All right, good. There's the optic disc, and I don't see any signs of any nicking or hemorrhaging. And I would complete the same test on the other eye. Okay. Now I'm going to take a quick peek into your ears, but before I do so, a couple more tests for unilateral hearing loss. This is a tuning fork. I'm going to place it on the top of your head. You just let me know if the sound is equal on both sides.
Okay. Yes, it's equal.
Okay. Next, I'm going to place it behind your ear. You just let me know when you stop hearing the sound. I'm going to put it in front of your ear. This is the Renee and Weber test. And let me know when you stop hearing the sound.
Okay. No. No.
Good. Okay. And I would repeat on the opposite side. Okay. So no tenderness in the ears.
Nope.
Good. I'm gonna take a peek. Okay. Bring the pinna up and back. Sorry, it might tickle a little bit. All right, so canal is clear. There is minimal cerumen on this side. The tympanic membrane is pearly and gray. No sign of any bulging. Other side. Okay, up back. Canal is clear, very clear on this side, and your tympanic membrane is pearly gray. Wonderful. Alrighty. Moving on, I want to do the Sperling test, which tests for any cervical irritation. So I'll have you just tilt your head to one side, and I'm going to put some downward pressure on your head, and you let me know if there's any numbness or tingling on this side.
Okay. Nope.
Good. And we're going to go the other side. Any pain?
Nope.
Very good. All right. Couple range of motion tests in the neck. You just go ahead and Go side to side for me and forward and back. Very good. I'm going to place some resistance on your head and just resist where my hand is placed. Good. Very good. Good strength. Okay, as I move down to the lower extremities, I'm always going to be cognizant of the skin, inspecting for any macules, papules, nevi, bullae, and using the ABCDE acronym. So looking for asymmetry, the borders, irregular borders, contour, the diameter, and also if there is any evolution of the nodule. Have you noticed anything on your skin that looks bigger, have different colors?
No.
Okay, good. All right. Okay, so going to palpate now your shoulder joints. Coming down here, looking at your skin. No swelling or sign of deformity. Looking at your hands. Let me see the tops of your hands here. It's good skin turgor and good capillary refill, brisk +3. Good. All right. Let's do a couple more range of motion in the upper extremities. So I'm going to have you flex your wrists and extend, radial deviation, ulnar deviation. Good. With your shoulders, or excuse me, your elbows at your side, internally rotate, externally rotate, flexion and extension. Good. And raise both arms all the way up, abduction. Perfect. And come back down. Great. Go ahead and spread your fingers out for me and don't let me close them. Good. And then squeeze both of my fingers. Good. Good strength. And while I was looking at the nail beds, there doesn't appear to be any signs of infection. There is no clubbing, and your skin looks healthy in those areas as well. Okay, next I want to do a couple specialty exams for rotator cuff injury or subacromial pain. The first one's the empty can test. I'm going to have you hold your arms out at about 30 degrees and internally rotate. I'm going to put some downward pressure. Just let me know if you have any pain.
No.
Perfect. Okay. Next, I want to do the drop arm test. So go ahead and hold just one arm out, and I'm going to hold it here and then flex your arm, and I'm going to let go. Good. And I would repeat the same on the other side. Next is the Hawkins test, testing for any rotator cuff injury. So I'm going to hold you here about 90 degrees, and you can relax your arm. I'm just going to put some pressure here on the shoulder girdle. Pain there?
No.
Very good. All right. Next is the near impingement test, where I'm going to just stabilize the scapula here, and then lift this arm all the way up. Perfect. Any pain there?
No.
All right. And I will repeat the same test on the other side. Okay. Let's move on. I do want you to remove your shirt, please.
Okay.
Always gonna take a look at the skin. While I have access here, I'm gonna just palpate infraclavicular lymph nodes, or excuse me, supraclavicular lymph nodes here, and then infraclavicular. All right, good. Okay. Looking at the back, starting with my visual inspection, I do see a couple macules. They don't appear to be raised, and the skin appears normal. I'm gonna now palpate scapula and spinous processes. Do you have any pain in these areas?
No.
All right, very good. I'm going to take a quick listen to your lung sounds. When you feel my stethoscope, just take a nice deep breath in.
Okay.
And what I'll have you do actually, Adam, is come over to this edge and face this wall. All right. So take a nice deep breath in when you feel my stethoscope. Good. Very good. I didn't hear any adventitious lung sounds. Next, I'm going to be doing a little bit of percussion, listening for good resonance. Excellent. Next, I'm going to look for thoracic expansion. So go ahead and take a nice deep breath in. Good. All right. A couple of specialty tests to also look for the presence of any consolidation would be tactile fremitus, just testing the vibrations equally on each side. I would place my hands on the ulnar surface and have my patient say the word 99 and feel if the vibration is equal on each side. Another test is whispered pectroliloquy, where I would have my patient say 1, 2, 3, and I would be listening with a stethoscope and see if that sound comes out clearly in all the fields. Also egophony, where I would also be listening and have my patient say the word E, and if it was compromised, it would come out more like A. Okay. While I do have my patient on the posterior side, in a pediatric exam, I would assess for scoliosis. In girls, it is about 10 to 12 years old. In males, about 13 to 14. Adam's spine appears midline, and there's no evidence of any scoliosis here. Okay, I'm going to tap on your back kind of hard. This is assessing for CVA tenderness. Let me know if this is painful at all.
No.
Okay, good. Alrighty, I'm going to have you turn towards the front. And I'm going to start with my visual inspection of the anterior chest. I do see some macules, but they do appear normal and they're not raised. Don't see any reddened areas. I'm going to palpate the precordium, feeling for any thrills, heaves, or lifts. Good. Also checking here, point of maximal impulse on the left side, which I can palpate. And in thin people, a lot of the times you can visualize it, which I can see here on Adam. Okay, I'm gonna take a quick listen. And I would listen with my bell and diaphragm. And you can just go ahead and breathe normally here.
Okay.
Or excuse me, take nice deep breaths when you feel my stethoscope, please. Good. Very good. I do just want to look for jugular vein distension here. So go ahead and turn your head this way and just visualizing the jugular vein, any distension, which I do not see. I do see a good strong pulsation. And I'm going to palpate your carotid here. Good. And turn the other way. Good. And I'm going to listen with my bell for any carotid bruit or abnormal vascular sounds. All right. Okay. listen to your heart now. So, okay. So, starting out on the left side here, midclavicular line, left sternal border, second intercostal space is the aortic area. Third intercostal space, pulmonic. Erb's point. Tricuspid. And mitral. Good, strong S1 and S2, no presence of any murmurs, or S3 or S4 heart sounds. Okay, so a couple more positions that I could have my patient in and listen for abnormal heart sounds would be sitting, standing, sitting leaning slightly forward, and also supine. But for the purposes of this example, we'll just verbalize. Okay. Are you doing okay?
Yeah.
Okay. Let's go ahead and I'll have you lay down, please. All right. So I'm going to be taking a look at your belly. Do you need anything under your head or under your knees?
No, I think I'm okay.
So starting with my visual inspection always, looking at the skin, I don't see any evidence of any scars or any abdominal surgeries. Looking at the contour of the belly, observing for any pulsations. The symmetry, the belly is nice and flat, and I don't see any abnormal pulsations there. All right. I'm going to take a quick listen. Going to listen for vascular sounds, so aortic, renal, iliac, and femoral. And in pediatrics, the femoral pulse is felt in the inguinal canal for newborns. All right, I'm going to be palpating. So first I want to percuss actually in all four quadrants, listening for good tympany in all four quadrants. Just going to be doing some tapping here. Very good. All right, I'm going to start with some light palpation. Please just let me know if any of it is uncomfortable.
Okay.
Identifying some structures in these areas. Well, that was okay. Okay, gonna do some deeper palpation. All right, no tenderness in those areas?
No.
Good. Next are a couple specialty tests that can show signs of acute appendicitis or cholecystitis. First is McBurney's point. So ASIS and lateral to the umbilicus. I'm going to put some deep pressure here. Go ahead and take a nice deep breath in. Good. So if there was evidence of cholecystitis, it would cause the cessation of it, inspiration. Next is McBurney's point, assessing for signs of appendicitis. So deep pressure here, right lower quadrant. Any pain?
No.
Okay. Another test that you can do is called Rothsing's, where it is on the opposing side, but the pain would be elicited on the right side. Pain here?
No.
Okay. Next is Bloomberg or rebound tenderness, where I apply pressure here, and if pain is elicited when I release, that is a positive finding. Pain?
Pain. No.
Very good. All right. A couple more tests that you can do for peritoneal irritation or appendicitis. One is the psoas sign. So I'm going to put some pressure down on your thigh, Adam, and just try and lift your leg up against it. Okay. Any pain on this side?
Nope.
Okay. Next is the obturator. You can just relax your leg here, up and across. Pain there in the belly?
No.
All right. Very good. Okay, moving on. I'm going to just lift your pant legs up here a bit. And starting out always with my visual inspection, the skin appears healthy. There's good hair distribution, no evidence of any edema. I'm going to palpate the pulses here, starting with popliteal. Okay, it's good, strong +2. Posterior tibial. Good, strong +2. And dorsalis pedis. And that is +2 bilaterally. Okay, while I have you here, I want to test for sensory nerve in L4 and L5. I'm going to use my tuning fork, place it right on your bony prominence, and you let me know if you feel the vibration throughout your leg.
Okay. Mm-hmm.
Okay.
I do. Yes.
Wonderful. Now palpate your calves here. Any tenderness in the calves?
No.
All right. And I'm going to perform Holman sign, which tests for any deep vein thromboses. Pain in there in the thigh, or excuse me, in the calf?
No.
Okay, how about on this side?
Nope.
Very good. All right. Okay, let's do a couple musculoskeletal tests for the knee. The first is the McMurray's test, which tests for any meniscus damage. Do you have any, have you had any injuries to your knees?
No.
Okay. Okay, so internally rotating. Pain there?
Nope.
All right, now I would perform the same maneuvers on the other leg. Next is the Lockman's test for anterior jaw, assessing the PCL. Pain there?
Nope.
Very good. No clicking was noted either. Pain?
All good.
Good. Okay. Next is the Lockman test, where I'm going to externally rotate and just apply some opposing force here. And this is testing the anterior cruciate ligament. Is that tender at all?
Nope. Good.
Okay. I'm going to apply some valgus stress, also testing medial cruciate ligament and lateral cruciate ligament. So valgus. Okay, Heard a little pop there. Was that uncomfortable?
No, that's okay.
And varus, stress, to the opposite. Pain there.
Oh, all good.
I'll be looking for, of course, a pain response or any excessive gapping in those movements. Next, I'm going to assess for any joint swelling in the knee space. The first is the ballottement test. I'm going to move distally on the leg and stop right at the patella. Come upwards proximally at the apex of the patella and just tap the patellar joint, the patella, and see if it floats at all. That side looks good. We'll repeat it on the opposing leg as well. Okay, while I have you supine, I want to do the Kernig's test for any meningeal irritation. So can you just lift your head up and take a look at your knees? Good. Do you have any back pain doing that?
Nope.
Okay. Last but not least, I want to do the passive leg raise, also testing for any presence of radiculopathy. Pain at all?
No, all good.
Okay. And relax your leg. Good. Passive leg raise. No pain?
Nope.
Wonderful. Alrighty. Put your pants and legs down for you. I'm going to go ahead and have you sit up, please. Alrighty. Doing okay?
Yeah.
All right. Couple more things. I want to assess some cerebellar function. So go ahead and touch each finger to your thumb. Like this. Okay. Can you slap the hands on your thighs? Very good. I want you to touch your nose and then touch my finger and just keep going. Excellent. All right. Go ahead and close your eyes for me, please. And hold out your palm. I'm going to place an object in your hand. You just let me know if you can identify it.
Okay. Chapstick.
Good. All right. And go ahead and open your palm out again. And I'm going to draw a digit. You let me know what the digit is.
2.
Yes, correct. Wonderful. I want to assess for carpal tunnel syndrome. We can do it by Phelan's sign. So hold the back of your palms together. And we would hold this for 60 seconds, but for the purpose of the exam, we'll just do a couple seconds. And a positive response would be any pain or tingling once you release. Is that painful at all for you?
Nope.
Okay. You can always also do Tyndall's sign. So I'll have you relax your arm here, and I'm going to percuss on the carpal tunnel. Any pain up here? No pain or numbness or tingling is a positive finding. All right, let me have you stand, please. And you can face this way. I'm going to do Romberg's test. So go ahead and close your eyes and hold your arms out in front of you, palms facing up. And here I'm assessing for any pronator drift. I would have my patient hold this for a good 60 seconds. For the purpose of the exam, we'll just do a couple. Looks good. You can go ahead and relax. And go ahead and turn this way for me. Going to visualize the spine again and stabilize the pelvis here. Go ahead and bend forward for me. Good. Spine is midline. You can come back up. Any pain there?
Nope.
All right. I'm going to have you kind of bend to each side, looking for range of motion here in the spine. Very good. Good. One of the specialty pediatric exams I could do is called the Bartolini maneuver, which is assessing for any hip dysplasia, where you abduct the baby's hip and move it back out and assess if there is any dislocation or displacement of the hip joint. All right, Adam. So I'm going to have you walk away from me on your tiptoes.
Okay.
Good. Assessing gait here and strength, and then walk back towards me on your heels. Very good. Go ahead and turn around, and I want you to go heel to toe. Perfect. And then come back. All right, excellent. Go ahead and take a seat. And I believe that concludes our exam. Do you have any questions for me?
No, thank you very much.
Okay, you're welcome.